Are you insured? The U.S. is currently the only industrialized nation not to supply its citizens with health insurance. According to a Huffington Post survey, more than 44 million Americans are still uninsured. 1/3 of Americans don't know that their families will be covered. Critics say that people are choosing not to be insured just to save money. And by going to the emergency room, they are saving money and guaranteeing the best quality care.
In a place, the United States of America, where we are the wealthiest and we can't take care of our own children, we've got a problem. And the problem is not just it's our children who are sick, it's the problem of our economy. We're trying to dig out of a hole. How are we going to dig out of our hole if the younger generation is constantly battling a healthcare crisis that they can't afford?
Speaking as someone who's on their parents' healthcare plan and who's in their 20s, it's nice to not have to worry about it and to get my focus on getting rid of my debt.
I believe in personal accountability and taking control of one's own life. I think it boils down to dependency. Young people, especially my own generation, view themselves as not accountable for their own lives.
I think that as human beings, we're all obligated to look after each other as much as we're supposed to look after ourselves. So healthcare, we should definitely look after each other with it, but we shouldn't just expect others to handle it for us.
Anyone who wants to get something for free sounds great. You know, my parents are paying for it. It's on my parents' tab.
When you look at both plans, right, for me, it boils down to two words: public versus private. As the plans are currently presented right now between a Romney plan and the Obama plan, I would say Obama plan. There's a little bit more mixture of public-private in the Obama plan, and there's a lot more private in the Romney plan.
It's Romney's. It's the restoring state leadership and flexibility, promoting free markets and fair competition, and empowering consumer choice. I think that is attacking the illness and not just the symptoms.
I like the mixture of public and private a lot more. Putting the plans into perspective of how our economy is structured. And when you do that, and you look at The Economist magazine, those plans actually move the United States ahead. It gets us out of debt. It handles a number of problems that we're having. That's what we need. We need more kind of the holistic thinking, not just healthcare by itself, but healthcare and the economy. But I think by mixing a little bit of Obama with a little bit of Romney on health, you actually get a better plan. So if Romney listened to Obama and Obama listened to Romney, I think we actually get somewhere. That's our problem. Until we have politicians who are actually mature enough to talk to each other, I don't think we'll get that optimal plan.
Now that you've heard from both sides, all we can do is wait. Until then, I'm Charles Kramer from WCSU News Election Connection.